Adolescents with Asthma by Jessica Price and Amber Martin. Objectives: explain how asthma is a chronic disease, identify common triggers to asthma attacks, discuss home management plan for reducing asthma attacks, discuss how asthma impacts various aspects of an adolescent's life, such as family relationships, peer relationships, and school attendance. Explain how nurses can overcome barriers and strengthen adherence to controller medications. Asthma is defined as a chronic inflammatory disorder of the airway. It is a leading chronic illness among adolescents and the leading cause of hospitalizations for adolescents. Asthma is one of the major causes of school absentees for adolescents, and asthma cannot be cured, but it can be controlled. Some common asthma triggers are tobacco smoke, dust mites, outdoor pollutants, cockroach allergens, pets, mold, smoke from burning wood, bad air quality, and physical exercise. It's important to be mindful of triggers and conditions that can cause asthma attacks for the adolescents, because this will greatly impact their quality of life. Group behaviors put adolescents at risk, such as being in contact with dust, allergens, and extreme cold conditions. The goal is to reduce the adolescent's exposure to triggers, so it's important for them to pay attention to air quality forecasts and stay indoors as much as possible on bad air quality days. Also, they need to learn what plants and trees they should avoid during pollination and make sure the windows are not open during these times. Parents have to ensure their living conditions are clean and free of mold, dust mites, and cockroaches, and the adolescents should be taught how it is important to wash their hands often. Home management plan of care. Though the adolescent with asthma may be doing well, they still need to use their controller medications to avoid triggers. At the first sign of wheezing, chest tightness, a slight cold, shortness of breath, or mild congestion, the adolescent needs to use their albuterol nebulizer immediately. If wheezing persists or the increased shortness of breath is increased or they have trouble talking, the albuterol nebulizer should be used every 30 minutes for 3 doses, and they need to call their doctor immediately. There are also psychosocial impacts on the adolescents with asthma. Family is a big part of that relationship. Family is usually the first people or the first ones to identify that the patient has asthma, usually because of the way the child is breathing at home, or the trouble sleeping, or the actual asthma attack. Adolescents struggle between dependence and independence, which makes it difficult for their parents to know how much attention is too much attention. Parents of adolescents with asthma realize that adolescents have a really high risk of death with having asthma. So sometimes parents can be overbearing or seem overbearing to the adolescents. So this makes the family relationship very sensitive issue for adolescents. Peers and school attendance. On average, an adolescent will spend 1,080 hours in school per year. So that means most of their time is spent in school interacting with their peers and with their colleagues, their classmates. So it's very important for the adolescent with asthma to not feel that they're labeled as being different. So a lot of them will choose not to disclose to their friends that they have asthma. But it's really important to build on their relationship with their peers, because if you build on the relationship with their peers, it will help them to adhere to their asthma medication regimen and to decrease negative outcomes of asthma attacks in crisis. School participation also is a big factor that goes into the adolescents that have asthma. It's very important to help the adolescent to establish a good relationship with the school nurse, because that nurse can educate the adolescent on how important it is to adhere to control of medications, to know what triggers their asthma attacks, and what treatment is important for them when it's prescribed, why treatment is important for them when it's prescribed from the doctor. So it's really important to build on that relationship with the nurse and the adolescent at that school. Also, the adolescent may miss a lot of days due to frequent asthma attacks or frequent hospitalizations. So it's also important for the adolescent to have a good relationship with their teachers and their, like I said, the school nurse, so that they can understand the reason for the absence, and so that the adolescent will not fall behind in their schoolwork. So it's also important to help to establish tailored needs specific to each adolescent that has asthma, so they can have a plan in place at their school for what they need to do for their medications, what they need to do when they feel like they're having increased wheezing, or they feel like they're about to have an asthma attack. That plan needs to be in place at their school. The nurse roles in adolescent adherence to control of medications includes using motivational interviewing, which is basically a technique which helps to use open-ended questions and statements to help an individual or the adolescent to come to realization at what things they need to change about their asthma control, and helps them to be more motivated to change and be more proactive in taking their control of medications and being aware of their triggers and knowing, what things they can and cannot do and how not to test the limits as far as their physical activity. There have been studies that have shown that motivational interviewing can help not only adolescents with asthma, but also they've shown help with diabetes management, physical activity, exercise, and things like that. Also, the nurse can use a technique called shared decision making, where the nurse and the adolescent negotiate what treatment regimen help to accommodate the patient's goal or the adolescent's goals and preferences. This is a very useful technique with adolescents because this gives them a chance to be involved in their care, but at the same time, you're not leaving them to just come up with the information on their own. They're actually involved in, okay, what treatment options are best for me and what treatment options are not best for me. And it helps them to feel like they're really involved with their asthma management. In conclusion, there are many factors that affect an adolescent and adherence to their adherence with their control of medications. And the nurse's primary role is to meet the adolescent and their family where they are, identifying what barriers are there for the family and the adolescent, and having everybody kind of come to a happy medium of, okay, the patient or the adolescent is taking their control of medications, and the family is giving the support, but not at the same time they're giving the adolescent the space and the independence they desire, but at the same time they're also being there for the adolescent when the adolescent needs them. Working together with the adolescent and family members and peers, the nurse can help reduce the complications of asthma through the use of motivational interviewing and shared decision making. This together will help to form a strong nurse-adolescent patient relationship with open communication and trust.